If you have experienced pain or numbness, it could be a pinched nerve in your back or your neck. We spoke with Dr. Javed Siddiqi, a neurosurgeon at Redlands Community Hospital in Redlands, California, on the source of the problem and what can be done.
Pinched nerves, first of all, could be in any part of the body. They could be in the spine, in the neck, in the low back, or they could be in the wrist, such as carpal tunnel syndrome that many people have heard about. And really what happens when the nerve is pinched is you get pain, you can get numbness, and if it's going on for long enough, you can get muscle weakness and atrophy. If those nerves that are being pinched are going to important structures such as bowel and bladder, you can lose bowel and bladder control, which can be serious and irreversible. In the spine, which is the most common kind of pinched nerve I deal with, usually it's from a disc herniation. So a cervical spine disc herniation in the neck could pinch a nerve that shoots pain down the arm, or in the low back you could have a lumbar disc herniation, which pinches nerves that supply the legs and the bladder and bowel, so you could have pain going down the legs. Usually the main thing people complain of is pain, and it's a kind of pain that in medical terminology we refer to as radiating pain, meaning it's moving. And the pain is shooting in the distribution that the nerve travels in the leg. So even though it may be pinched in the back, the pain is in the leg because that's where the nerve travels and has distant branches to. If the disc herniation persists or expands, the ruptured disc, which was pushing on the nerve, can then push on the spinal cord in the neck. And that could be limb-threatening. I mean, it could cause paralysis.
We asked Dr. Siddiqi, how do you diagnose the source of the pain?
We diagnose pinched nerves in the spine with a good history and physical exam, and that's complemented by usually imaging, such as MRI scanning. The treatment for the pinched nerve is determined by the severity of the problem, where the problem is, and what the deficits are. So for example, a pinched nerve in the neck that just happened a week ago and which is getting better will continue to get better most often with conservative management. A pinched nerve that continues to get worse despite conservative treatment like bed rest and pain medications may need surgery. It's a major surgery, but it's certainly not experimental or anything new. Lumbar disc surgery in America is the most common operation done by neurosurgeons. So it's a very common operation, it's a common condition. The purpose of the surgery is to decompress or unpinch the nerve that's being pinched by the disc herniation. Now, the nerve itself is made up of millions of fibers like a telephone cable. And these fibers carry information for pain, different kind of sensations, and strength. And the longer the nerve is pinched, there's a greater chance that more of these fibers could be injured irreversibly. And so if you get to that stage, however long that takes, and then you decompress that nerve, which has irreversible damage in it, then decompressing it will not help the symptoms. When there's an obvious nerve pinching from a disc herniation and you remove the disc, the pain relief is pretty rapid. Sometimes in the recovery room after surgery, but certainly within a few days to weeks.